Hey, good morning, everybody. It's Dr. Bruce Gilroy here with Health Source Chiropractic in Atascocita, Texas. And today, man, the date is the 6th of March, and it's our morning where we don't see patients, but we do a lot of catch-up work this morning. We got reports we got to do. We got just numerous behind the scenes things that we have to accomplish that allow us to make sure that when you're here and we are seeing patients, we can focus on taking care of you. So happy Thursday to you. I hope you've had a great week so far. Spring looks to be springing outside today. It looks like a gorgeous day and a nice looking weekend coming up. So I hope you're going to get outside and get some of that medicine that I love to get and I love to make sure you guys get, which is fresh air and sunshine. So make sure you get a chance to do that when you can today. All right, today and this weekend. Enjoy the spring weather because you know the warmth and the humidity, well, who am I kidding? The heat and humidity are coming soon. So today I want to talk about something that we brought into our office about 2 years ago, okay? Boom, it's this guy right here. This is our high-powered laser. It's made by a company called Zimmer out of Germany. It's a hot laser, and we've been using it now for 2 years and still getting better at knowing how to use it for our patients. Now we're even revamping some things these days to make sure we can use it better for you folks. Now, what is it? You know, you may look at it and go, well, that looks very high tech, Dr. G, and it is high tech. But what is it? It's a high-powered laser, and what do we use it for? Well, you know what? When people come into my office, you come in because you have pain. You know what? When you have pain, you have inflammation. And we need to knock some of that inflammation down sometimes, right? So that's what we're trying to do. So we will use it to reduce pain and inflammation rather quickly. Many times with our patients, probably 75% of the time or more, patients will come in and their pain level may be a 7 or an 8, and we do the laser on whatever area is bothering them, and we ask them again, what's your pain level? And it's going to be a 5. It's going to be a 4. It's short-lived, but it starts bringing that challenge down of the pain. We want to knock that down as quick as we can in a safe way as possible, and our high-powered laser allows us to do that. One of the other things that it's really great at, and for someone like me who is in this aging season of life, and I'm now well versed in the aging season of life, is it actually speeds up the healing process. This type of therapy works at the cellular level to affect the mitochondria of the cells and speed up the metabolic rate of the cells. When you speed up the metabolic rate of the cells, you then increase the rate of healing. As we get older, once we get past a certain age, guess what happens? Our metabolic rates in our cells slow down. The rate at which they repair and replace themselves slows down, and so healing takes longer. If you're older than 40, you know this because you know how long a bruise may take to go away. You know how long a cut or a scratch may take to go away. And so this particular therapy allows us to speed that process up for you. So yeah, we're going to reduce pain and inflammation pretty quickly. We're also going to speed up the healing process for our patients. What have we used this on? Well, obviously we've used it on neck and back problems because we see that all the time. Sacroiliac joint issues, hip pain, IT band pain, which some people mistake for sciatica sometimes. We've also used it on shoulder tendinitis a lot, elbow tendinitis like tennis elbow, things like that. Simple thumb, foot pain, plantar fasciitis. Man, we've seen some great results with this tool in many different ways. It's just one of the many different ways that we're able to provide good care for our patients and help people get healthy naturally without the use of drugs or surgery. So we're all about that here. That's the whole reason I got into chiropractic. I can remember 30, 40 years ago, I had a job that would allow me when business was slow to do some studying. And I remember having my books out one time, and a customer came in. I was working in a golf pro shop, and one of the members of the country club came in, and he asked me, he says, why are you a chiropractor? I said, well, I figure if I can help people get through neck and back pain and without having them have to take drugs or have surgery, I'm doing a great job for my community. I still feel that way. And of course, if you know me well enough, if you've been a patient here long enough, you also know how committed I am to teaching health and wellness principles to our community. And so anyway, this is just, again, another new tool that we brought in 2 years ago. So I guess it's not quite as new as it was, obviously, and it allows us to help our patients get better faster and stay better longer as well. So, all right, so there's some information for you. We're in the middle of a series where I'm kind of going through different things that we do here that you might not be familiar with. Everyone knows that a chiropractor can take care of neck and back pain, and they may know that about chiropractic adjustments, but they may not know the cutting edge technology that we're able to use to help our patients get better. All right. Hey, if you're getting this via our weekly email, make sure that you check out the recipe of the week that is attached. It is a very healthy version of some stuffed mushrooms. I'm going to make that this weekend as a side dish, possibly for one of my meals, and it looks really, really good. And I hope you get a chance to try it out. Not long ago, I posted a recipe for a keto deviled egg salad, and I made it last night. Actually, man, it's what I call a maker or a ginner, because it's really, really good. So I'll make it again sometime. Yeah, it's a keto deviled egg salad. Super good. If you love deviled eggs, you would love this. Super great for you. And so we hope that we're giving you recipes that you can use on a regular basis at your place to learn how to eat very tasty meals that are very, very healthy for you. Remember, what I say a lot of times, you don't have to always eat a salad to be healthy. You don't have to only drink green smoothies and juices to be healthy. You can do all that, and it's all okay. But you can also eat some really amazing meals and be nourishing your body in a good, healthy way. All right, I'm getting off track here, so no whole nother topic. We're going to be in the office seeing patients this afternoon, starting at 2:30. Tomorrow's half day Friday, so we'll only be until noon. Call us if you need, 281-852-5600. We'd love to see your smiling faces. And thanks so much for the referrals. We got some more referrals this week. Gosh, we do appreciate that. Thank you guys so much for that. We appreciate the trust you put in us, and we promise we will do our best to make you feel good about the trust you placed in us. Okay? Have a great Thursday. Enjoy spring, and we'll talk to you soon. Take care, guys.